Thank you, Mr. Chairman. Let me say once again, as chair of the Congressional Black Caucus, how grateful I am to Congresswoman Marcia Fudge, the gentlelady from Ohio, for continuing to lead our special orders on Monday evening and for continuing to keep our caucus very focused on the key issues addressing and facing our nation today. And also, let me thank you for your sacrifices and everything that you do each and every day to make sure that this hour is solidified so the rest of the country really understands the Congressional Black Caucus's agenda as the conscience of the Congress. Thank you, Congresswoman Fudge. Let me thank and acknowledge our colleagues, Congresswoman Donna Christensen first, who chairs the Congressional Black Caucus Health Brain Trust, also serves as the second vice chair of the Congressional Black Caucus. She has been such a phenomenal leader in leading the House of Representatives and really our country to address racial and ethnic disparities, health disparities in our country. And let me take a moment to thank Representative Danny Davis, who co-chairs the Congressional Black Caucus's Health and Wellness Task Force, along with Congresswoman Christensen. Together, they have developed a very comprehensive set of principles with regard to health care reform, and I would like to ask, Mr. Speaker, unanimous consent to insert a copy of those principles for the record this evening.
Without objection.
Also, let me thank and recognize Congresswoman Eddie Bernice Johnson, who brings a wealth of knowledge and expertise to this health care debate. As a registered nurse, she has been very involved in health care reform for many, many years. And also, she has a statement tonight that I would like to ask unanimous consent to insert into the record because she has a very clear perspective on what needs to be done in health care reform, and I have her statement I'd like to insert.
Without objection.
Thank you very much, Mr. Speaker. First, let me just say, as one who personally supports a single-payer form of universal health care, I also believe that health care must be and should be a fundamental human right. But I also know that whatever form health care reform takes, that we must have a public option very similar to that of Medicare. 47 million people lack health insurance in America, and although racial and ethnic disparities account for about racial and ethnic minorities account for about 1/3 of the United States population, they account for more than half of the uninsured. In my district alone, in Alameda County, and also throughout the country, though, there are very profound inequities in health insurance coverage between various racial and ethnic groups. Among non-elderly adults 18 to 64 years of age, Latinos are 5 times as likely as whites to be uninsured. African Americans and Asian Pacific Islanders are also more likely than whites to be uninsured. And because medical costs have been steadily rising, medical bills are the number one cause of bankruptcy in the United States. In today's economic climate, with unemployment numbers, for instance, in my own state of California reaching over 11%, that means that millions more are falling into bankruptcy every day. And of course, that means millions more are losing their health care coverage. And of course, African Americans, Latinos, Native Americans, and Asian Pacific Islanders, unfortunately, are disproportionately affected. The statistics are irrefutable. African American women are nearly 4 times more likely to die during childbirth than white women from pregnancy complications. Nearly half of all those living with HIV and AIDS in the United States are African Americans, and the AIDS rates for African Americans is nearly 10 times that of whites. And a recent study by the CDC found that nearly 1 in 2 young African American girls is infected with one of the 4 more commonly sexually transmitted infections, as opposed to 1 in 4 among the general population. African Americans are 2 times more likely to have diabetes than whites, and African Americans are nearly 3.5 times more likely than whites to have an amputation as a result of their diabetes. African American men with colon cancer are more than 40% less likely than white men with the same condition to receive major diagnostic and treatment procedures. While medical science has made a lot of advances over the last 10 years, the gains made by the discovery of new drugs and treatments has not passed on to all segments of our population. For example, going back to my own district in Alameda County in California, from 2001 to 2003, we had an average rate of 2,033 people die of coronary heart disease, a mortality rate of about 160 per 100,000 people. Across every category, though, African American men and women in my district had higher rates of mortality rates than any other group, 286 per 100,000 for African American men and 199 per 100,000 for African American women. While the overall mortality rate has declined in my district by 7% since 1998, the gap, mind you, the gap between African Americans and the overall county rate has grown dramatically. In 1990 to 1991, the African American rate was 16% higher than the county rate. In 2002 to 2003, it was 50% higher. Something is seriously wrong. The story is the same with cancer and with diabetes. And these statistics are not only in my district, but they're reflected throughout the country in all of our Congressional Black Caucus, Congressional Hispanic Caucus, and Congressional Asian Pacific American Caucus members' district. It is a shame and disgrace. This is a serious, serious health care crisis that warrants a clarion call immediately. Our nation has failed to guarantee what is often federally funded health research, which fully benefits everyone across the nation. And so that's why we're here tonight, Mr. Speaker, to speak with clarity, with one voice, to demand health care reform now, and to demand an end to the factors that perpetrate racial and ethnic health disparities in this country. We can't do one without the other. I'm sure that Congresswoman Dr. Christensen is going to review tonight the Health Equity and Accountability Act. Let me just mention a couple of the provisions. It will bolster efforts to ensure culturally and linguistically appropriate health care and remove language and cultural barriers to health care. It will improve workforce diversity. It will strengthen and coordinate data collection. It will ensure accountability and improve evaluation, and it will improve health care services in general. This is the Health Equity and Accountability Act, which Congresswoman Christensen has worked so hard on with our Tri-Caucus for several years. It will help put our country back on track to eliminating health disparities in our country. So I must applaud again Congresswoman Christensen and her staff for spearheading the development of this initiative, and I look forward to its introduction in the next few weeks. Finally, let me just say, we all know that the profit motive has driven the healthcare industry. It should not be an industry. It's an industry that has rewarded and provided profits for the wealthy and for the insurance industry, yet it's been, unfortunately, at the expense of the people it's intended to serve. And so as the conscience of the Congress, we are insisting that the public health option or a public health option similar to Medicare be part of any health care reform package, and that closing health care disparities be part of any health care reform effort. These are central principles that we are making sure our perspective incorporates as it relates to whatever health care bill comes out, because quite frankly, we can't have some of the same old business in the health care business. And so thank you again, Congresswoman Fudge, for this evening. And let me just say, we're sounding the alarm once again that members of the Congressional Black Caucus, we're not going to stand for any health care bill that doesn't include closing health care disparities, which our community, unfortunately, has suffered under since our presence here in the United States of America. Thank you very much, Congresswoman Fudge.
Thank you, Madam Chair.